I am a midwife and I work at Guy's and St Thomas's, and I applied for the Clinical Academic Training Fellowship originally in July 2012, and I was shortlisted but I didn't get it, but I got it on the resubmission and I started in March this year. Oh, does work, good. So a bit about my background. I qualified as a midwife in 1998 and started working in the research department where I am now in 2003. So I've been working in research for quite a long time as a research midwife, and the King's College London and GSTT became part of King's Health Partners, which is an academic health science centre, so I'm very fortunate in the sort of environment I'm in. We do a lot of research into prematurity, and we have a preterm surveillance clinic where we do a lot of research, but we also provide clinical care for women at risk of preterm birth. So I have a clinical input there too, and I've taken part in some teaching activities as well. I've had an opportunity to do that. I'm totally committed to getting the research that we do into practice as well. So I've written some trust guidelines, and I've also been an expert advisor for NICE writing guidelines too. So this is all before I started my application for the NIHR Clinical Academic Training Fellowship. The idea was put to me by our head of department and one of my colleagues who's now one of my supervisors, and I wasn't too sure, but the more I looked into it and realised that it wasn't just about getting a PhD, what I did like about it was the clinical side of it as well. I didn't want to just completely disappear academically, but I wanted to keep a clinical development going as well, so it turned out to look really attractive. So it wasn't just paying for the PhD or the project, but the fact that it paid for your salary as well is like a really important thing, especially at that point in maybe more senior parts of our career. We can't suddenly just drop everything and not have that full, so that was obviously really important. But it also paid for this clinical development, clinical training as well, and really the more I looked into it, the more I just thought it just looked too good to be true, really, not to at least have a go. Obviously you've got to be really committed to this sort of thing, and I never doubted that my commitment. I'd recently, well not that recently actually, a few years ago I did a master's degree, so I think I have the academic ability, although I've still got the old imposter syndrome, but apparently that stays with you. But there we go, I'm not the only one, so that's all right. And obviously it's going to affect my family, so I thought about it and talked about it and decided at the end of the day it was just, I had to go for it really. The main problem was at this point I only had 7 weeks in, which was a bit of a worry. But the first thing is to really get that. You've got to have the academic backup and you've got to have the clinical backup as well, because all these people, there's hundreds of people that need to support the application and sign it off. So that's the first thing really, is to make sure that you've got the backing, and I was very fortunate I did. I had to start off by thinking about the project, because I didn't want to spend a lot of time thinking about all the other bits of the application until you've got a feasible project, because you could just waste your time if you didn't end up with anything. And I didn't have anything sort of bubbling in the background, but I had to think really, really quickly. And that took me about 3 weeks of this 7 weeks I had with the original one. And I think I definitely was thinking about it 24 hours a day, because I was waking up in the middle of the night and it was all churning over. Thinking it all through, talking with my colleagues, I had to come up with something that was something that I was committed to, that I really wanted to do, because if it's funded, you've got to do it. But something that was feasible, but something that fitted in with our research remit really as well. This sort of briefly is my project. I'm interested in threatened preterm labour, and we see women in our clinic who are at high risk of having their babies early, but a lot of women have babies early who aren't high risk. And there's a lot more women who turn up to labour wards and their assessment units where they're in what we call threatened preterm labour. So they're having symptoms, but the vast majority of them are not actually going to be in real labour. But obviously, not necessarily obviously, but the consequences of having sent somebody home who is really in labour, can obviously be quite devastating. So a lot of these women get treatments and get admitted or transferred, what have you, unnecessarily. So my project is about really trying to decide from all those women who's most at risk. So it's about risk assessment, and it's using, well, risk factors, looking at all their risk factors if they've got any, but also there's fetal fibronectin test, which is like a swab that can give us a reading of how much a certain protein is there, that can be give us an idea of their risk of if this is real labour or not. Another test is cervical length measurements done by transvaginal scan, which, although all the literature will say it is actually quite predictive of whether this woman's really in labour or not, it's not done very often in the UK, and it's probably because there aren't so many people trained to do the ultrasound scanning, but it's definitely a good thing and we ought to be doing it. And then basically putting all this information together and coming out with individual risk scores for individual women in this situation. You know, how likely is she going to be actually really having the baby or not? So that's in a nutshell, that's the first part of the study. And then I'm also going to look at women's experiences and their views and the factors that affect whether they accept or don't accept the interventions that are offered or not offered. So there's a qualitative element to it. Now, I haven't got any experience in qualitative research as well at all, but I did want to I want to learn about that. You know, so if you're going to, you have to know everything really and sort of try and understand lots of different methods, and the best way of learning about it is by doing it. So my supervisors have got very good at this too. So. I've got 3 actually. So I cover everything. And then, so I've got a project, which was Hugh, and then you have to think very carefully about this detailed training programme, and individual to you, but it also involves this clinical development element. There we go. Oh yes, so you have a formal training in your PhD programme, but as mentioned before, there are other courses that you can go for outside your institution, maybe that are more suitable for the methods, or I've opted for a special leadership course towards the end of the fellowship that hopefully help me further on with being a clinical leader. The conferences, there's £3,000 on that, so it sounds like loads, but when you sort of include the registration and the travel and everything, it's one of my points is about reading the guidelines, and I did read the guidelines and I read them again, and then right at the end I realised that there was this £3,000 limit, and I'd sort of put in for loads of things, so I very quickly had to decide on these are 2 international midwifery conferences over the course of my 5-year part-time fellowship. And they're really brilliant, and I really love going to them. And I thought I'll put in for those, and that took me up to the 3,000, just these 2. But you can think, like the local ones, the ones in the UK or even Europe, you can get other local funding, and the university you can apply for other funding or even pay for yourself. So I would, aim at the big international ones that are going to cost a load of money and pop them in there. They also like to support overseas collaborations, and there's a preterm research group that's based in the Netherlands, and I've opted to go and see them, and that's been paid for too. But you can also detail any other teaching or learning opportunities that you can get as part of your college. The clinical development, I'm learning to do scanning, which is brilliant, not just for the project, but also as it develops me as a midwife as part of my practice. In our preterm surveillance clinic, one of the most important things we do is measuring cervical length. So I can show how it works for the project and for my practice clinically. So you worked out what your project's going to be and all your training program, and you've really then got to work out how much it costs, and that can take quite a while. And I have experience in costing research projects and budgeting, and before I trained to be a midwife I was an accountant, but I still needed to get the financial help with the finance department, both of the institution. I opted to go through King's College London, so they have to sort of work out what your salary is going to be for the next 5 years and all the extra costs and that sort of thing. So you need to get them on board early on, I'd say, as well. And they're one of the people that got to sign it off. And also the R&D department, you're in the hospital, your trust, they have to agree your NHS support costs and treatment costs as well, and they've also got to sign it off. So that can take a little while. When you've done all that, you've also got to, although it's not a separate CV, it's all part of the application form, which I must say now it's online. When I first applied, it was this interactive PDF, which was a complete nightmare. I thought I could cut and paste everything over, and then it just didn't fit, and this was all in the 7 weeks. As part of the application form, like, blast them about how marvellous you are and what you've done and how suitable your experience is and how that fits in with everything, the project and where you want to go. And you might not feel very comfortable blowing your own trumpet, but that's like really, you've just got to do it really, and you've got to write it for, about you and not your team and stuff. And I did that to start with because it just felt more natural, but the RDS were actually really good at pointing that out. Well, they're good at pointing loads of things out. Peer review was just so important, and I was so lucky that I was based in a research department anyway, but I'm constantly talking to everyone all the time about the project, about whether it's going to work, and the clinical people too. So that's really important, right from the word go and all the way through. And the PPI, which the NIHR have always been has always been very important to them. And when I first put my application in, although we always talked to the women and we always got sort of feedback, we didn't have a formal PPI group, patient public involvement group. But between my original application and my resubmitting, we actually set up a PPI group of our own, and women who've had experience of preterm birth, they come, and we literally had a meeting last Friday actually, which was really brilliant. They're fantastic, and I'm totally convinced it's not just about ticking boxes. It really does make what you're doing really more important and much better and works better and everything. So that was really good. They helped me out as well. And because the RDS, they were absolutely brilliant. And it's been a while ago now, I suppose it's sort of over 2 years ago, but I look back at the emails that I got from them when I put both my original and the resubmission. How they got back to me so quickly with the first one, I don't know, but they did. And both times it was such brilliant feedback. It was really detailed. They clearly read it, which I know that some people, when you show them things, don't actually read. But they clearly read it and step by step and each bit, not just about the project, but all about you selling yourself, and it's about the application, about you, all the different parts of it. There's really specific, helpful advice about how to improve this application. And then if you get an interview, that's brilliant, but then you've really got to, and just going through about that interview is making me feel nervous, just remembering it, because it was pretty scary, but it's also really true about these mock interviews. I had a practice interview with my colleagues to start with, who are sort of nicer, but really pointed things out that I thought I'd covered, but I hadn't. I mean, even to the point of at the beginning of my my presentation at my interview, I hadn't even said I was a midwife. So that sort of remembering your audience thing is you've got to remember the fact that this is an allied health professionals. You're not just nurses or midwives. And I had to really set the scene, and I just hadn't done that. It's just so important to just get all that practice. And the mock interview with my head of department and my supervisors was really a lot more scary than the real thing, actually. So it was really worth doing. So if you're not fortunate enough to have that environment and that backup where you are, then it's great if the RDS can do that for you too. So yeah, summary, I'd say really worth it, and I think you should go for it. And when I didn't get it the first time round, the main feedback was because it was too ambitious for a PhD. And when I looked at it and thought about it, and I thought, well, I've got to resubmit then, because it's easier to take stuff out than put things in. But when I looked at it again, I thought, how did I ever think I was going to do all that? I mean, it was just ridiculously over-ambitious. I wish my supervisors had actually pointed that out earlier, but they obviously didn't get that much time either. So I had a little bit longer, but a lot of the work had already been done, but it still took a couple of months to really get that application redone, looking at the feedback they'd given, going back to the RDS, and resubmitting it. But it's really good, fantastic opportunity if you can get it. I'm still pinching myself, thinking I can't believe it really. And the main thing I'd say is you really need loads of time. There's so many people that have got to be signing it off, and they've got to be aware of it, they've got to support you to start with, but they've actually got to read all your application online and sign it off. before the deadline, and I made a list of everybody who needed to sign it off and what their availability was in the couple of weeks coming up to the deadline. So if they were away or out of the country and stuff, and I sort of had a list and ticked them all off, made sure that it was all okay. And guidelines, just read them and then read them again. They're really good, actually. You just got to work through it and go through it. And as I said, the online application is much better than the previous way they were doing it. Research design service, fantastic help, and loads of just everyone around you to help, and a PPI group. And if you don't have one, you can go through the RDS or your local place, you might have one, or if you haven't got one, you can think about maybe setting one up if you've got a defined user group. And be realistic in your project, how long it's going to take. Obviously it's got to be feasible, or it won't get through. And be passionate about it, and that's got to come across as well. You've got to really want to do it, because you're going to be stuck with it if you get the funding, and they're not going to pay for you if you don't seem like you really want to do it. And I think ultimately also, apart from the time, is remember what they want. They don't just want people who are using this to fund their PhD. They actually want you to be the clinical academics of the future. So although my presentation was about, you've got your 5 minutes and it's supposed to be about the project, this I put up as a last slide just to sort of quickly reinforce the fact that, this is what I'm doing, this is where I see the fellowship is going to take me in the future. And also, I think everyone needs a bit of luck, so good luck as well. Thank you.
That's great, thank you, Jenny. There's probably time just for one or two very quick questions. Have we got a question?
You mentioned the overseas experience, and actually you might not know about the other schemes, but I just wondered what you remembered from the guidance about overseas components of other fellowships, or this specific one, what was encouraged and where the limit was in terms of
I can't remember if there was a limit. I think it's sort of about, they want to see that you're thinking sort of in a wider sort of global thing, and they want to encourage the overseas collaborations for your future research career, I suppose, as well. So I think it probably depends. I don't remember there being an actual limit on it.
But yours was a couple of visits to another team, was it, in another university?
Well, there's like a research team in the Netherlands that hosts sort of preterm birth stuff. So just went for that.
Hi, I actually work at Guy St Thomas's, so I'm quite familiar with the department. I'm just curious to know about your academic supervisor. Is it someone that holds an academic position within King's, or is it someone that is in between, as it often happens to us, and has also got a formal trust clinical position?
Well, I think for PhD supervisors would have to be academic supervisors. I'm really fortunate in that that where I work, we are sort of quite embedded in the clinical side of it as well, and really sort of totally multidisciplinary, and we're really fortunate. But I pick my supervisors who's really good at being a PhD supervisor, another one who's good at being a PhD supervisor, but it's more the midwifery and the qualitative side, and then another I've got another one as well who is like a leader clinically in the field as well as being a leader clinic and academically, who doesn't have a lot of time, but I want him there so that I've got him, and if I can get some time with him, that's really helpful too. So, but yeah, I think you have to choose your supervisors carefully. They obviously.
Great, thank you. Thank you, Jenny.